Just joined us. Today we've been talking about affirmative action and supply diversity. We've been asking the question, in today's multicultural Britain, do we really need it in the world of business? Now, as always, I'm joined by my special guest each week, and this week is no different. Her name is Dr. Sarah Hepburn, and she has a practice on Harley Street. So, Sarah, hello.
Hi.
Welcome to Sisterhood. Well, first of all, let me introduce you to our co-host. This is Abby.
Hi.
This is Sue. And this is Sophie.
Hi.
So, to come to you, from completely honest, is the fact that you were a woman, and it made me feel a little bit more comfortable that I could come in and be honest and open and have a chat. And so tell us what it is that you do, my darling.
Okay, I'm an orthodontist.
Mm-hmm.
That means I straighten teeth.
Yep.
So initially I qualified as a dentist, and then you go on to do some specialist training to become an orthodontist. So that takes about 11 years.
Wow.
11
years of study. Studying.
Absolutely. You have 5 years of dentistry, then you do some jobs in between to be able to get on to your specialist training, and then it's 3 years of that.
Fantastic.
Wow. So yeah, it's quite a long pathway. It's worth it in the end, because you end up having your own practice if you want to go down that route. And I think it's a good career for women as well.
And you've got your practice on the very prestigious Harley Street.
I have.
So tell us about that journey.
Okay, well, initially after qualifying as an orthodontist, I worked in a few different practices to see what you like and what you don't like. It's important to sort of like get an idea of what's going on everywhere else. And then eventually I purchased my own practice, and so now I can go to work in an environment which I've created, which is
fantastic. Can I just, are there a lot of women in your industry, or what's the balance like? Fantastic.
Why do you think that is? I think dentistry is a good career for women. For example, you can have your own practice, or you can work with somebody else. You can work full-time, part-time. You can stop, you can go back to it. So
right.
That flexibility, which is really good.
And I mean, Dr. Sarah Hepburn, we've been talking on previous shows about the importance of women being able to have that flexibility, so that you can have children if you want,
Yes.
So your industry suits that.
Do you work a lot of hours? What's a typical working week for you?
It's a 5-day week, if I want,
yes.
or I can reduce it. I can take holiday when I want to. It's entirely up to me.
Fantastic.
And what do you personally get out of it? What were your reasons for starting, and now what do you get out of it?
I think you get a lot of satisfaction from your work, because people are so happy by the end of the treatment. And now what I've specialised in is braces on the inside of the teeth.
Yes.
And this is making a big difference to orthodontics.
On the inside?
Yes. It's called lingual braces. Your conventional ones, the ones which you see on the outside, the metal ones. This is now completely different. And for example, this is what I use, and this product is called Incognito, and it's a custom-made appliance, so it's made only specifically for your mouth.
Wow.
So you take impressions, and then the actual appliance itself comes back. And so the wires as well as the brackets are only made for you, so it can't fit anybody else.
Now, I must tell our audience, Dr. Sarah Hepburn, before you go ahead, that if you are watching the show and you feel a little bit squeezy when it comes to teeth, then you might want to turn away, because we do have some images of some before and afters, don't we? So sorry, I apologise. Do continue telling us about the actual brace itself.
Yeah, so because it's custom made, it fits very well to the tooth. So it's very flush to the tooth surface. This means that patient comfort is increased. You don't have so many problems with ulcers. You don't get me wrong, you will still have initially some problems with speech and with having some difficulty with rubbing on your tongue, but then that goes away quite quickly. So, considering this is on the inside, this is exactly what
I think that's the main thing, isn't it? You can't see.
Wow, absolutely.
That actually looked really nice.
Invisible. And the appliance that I'm using is actually one of the most used in Europe as well, and it's even used in the universities, like for training as well. So it's a really well-known product.
Can it be used for children as well?
Yes, absolutely. It's used a lot in adolescents and adults. The good thing about it is, because it's custom made, that, for example, if all the teeth are not quite through and it's still one is erupting, you can still make a bracket specifically to that tooth.
Brilliant.
So it still fits perfectly.
Typically, how much would that cost for a system like that?
It really depends on where you go, but I think prices range from between about 7,000 to about 9,000.
Okay. So, Dr. Sarah Hepburn, we do have a caller on the line for you. So if you don't mind. So, caller, welcome to Sisterhood. Hello, caller.
Hiya.
Hello, what's your name?
My name's Stephen.
Hello, Stephen, welcome. I believe you've got a question for the doctor.
I just come out of hospital and basically just sort of moving back into the work sort of place and just didn't really know sort of how to come out of hospital if you should sort of take it easy or whatever sort of thing.
So you were saying you've just come out of hospital and you're not sure if you should take it easy before going back into the workplace?
Yeah, that's right, yeah.
Okay.
Right.
But the only thing is Dr. Sarah Hepburn deals with teeth. Do you want to answer that anyway?
Well, if you just come back into the workplace, obviously you need to sort of, I don't know why you were in hospital, but for whatever reason, then obviously when it comes to your health, you've got to look at that, initially and always take something slowly.
Absolutely.
So whenever you're ready for something.
Thank you. Well, thank you for your call. So, so tell us, some of the people that come in, you're giving us the price,
yes.
and you were saying how much exactly? Approximately?
It ranges from about 7,000 to about 9,000 pounds.
Okay. Now, some would deem that as being very expensive.
I think that's expensive.
Okay.
But it's worth it, I think.
Yeah. Okay, but you've got to remember that this appliance is custom made purely for you. You can have other appliances which are not custom made, so you don't have the laboratory fee which goes with that. But if you want something which is going to give you a really good, excellent result, then I think you'd probably want to go with that system.
This is like the Rolls Royce of braces, isn't it? So it's more on the cosmetics.
It's much bigger in America, isn't it, teeth?
Yeah.
Is it?
Yeah.
Do you think? I don't know. Is it?
They're obsessed, aren't they? Yeah,
And they all have
They're obsessed with
insurance.
having braces on the outside. They're not so, they got a little bit scared about doing braces on the inside because it's a bit more difficult. And the appliances which they had before weren't as good as Incognito.
Right.
So as a consequence, it was very difficult for the orthodontist to achieve good results. So now we've got a system which really works.
Brilliant. Can we see some of your works? I know that we've got some images.
Images.
Fantastic. Okay. So, do you want to talk us through that?
Yes, just to sort of like say, because we have got some images, just in case you don't want to see all of these. Look away now. So this is basically one of the, a patient which came in, and this is her start photos. So this is her from the side. You can see she had a cross back there, and from the front you've got a tooth sticking out as well as one behind. And then if we continue with the photos. Yeah. So not everything is aligned. This is her upper artery. You can more clearly see now exactly how things are not well aligned, and also some crowd in the lower. We put the brace on now, so this is what it looks like to start off with. Now in this case we had to do an extraction so that we could fit all the teeth in and correct the occlusion. So you can see the space there was to allow for us to align that tooth.
Right.
And so that's basically what it looks like.
And how long does it last? How long does it stay on for to fix the
It
teeth?
really depends on what kind of occlusion that you have to start off with. But it can be anything from like a year to 18 months. That's sort of like the normal time.
And you keep it on, or can you take it out?
No, you can't take this out. This is fixed in.
Dr. Hepburn, is this more of a like a cosmetic sort of procedure? Is it something that you would do more for vanity as opposed to practicality? What a lot of your patients do they?
I mean, if you just saw the pictures there,
Yeah.
if you had teeth which looked like that, I think that you've got the possibility of trauma to your teeth. If,
Yes.
for example, she had a tooth which was, her upper one was on the inside of her lower,
Right.
so you've got the possibility of trauma.
Right.
It is both aesthetics as well as function.
Right, because there's other versions of this system, I assume.
Yes.
Other types.
Sorry to interject, ladies. We've got a caller on the line. Caller, welcome. Hello, caller. Hello, caller. Oh, I think he's maybe disappeared, or she's disappeared. Hopefully they'll come back. Okay, so you were saying.
Yeah. So yeah, I think it's both for function as well as for aesthetics.
Now, we talk a lot about the role of women in business. This show's all about that, how we can help to navigate our way through the path to proceed and get a good career. Do you find that you get women coming in and saying, I need this specifically for my job roles, or because I want to build my confidence, so I therefore can perform better in work?
I think a lot of it is to do with your confidence, because if you've got a good smile, it makes you feel good.
Right, okay, the caller's back, I've just been told. So caller, welcome. Hello, caller. He is playing peekaboo with me, isn't he? Or she. We're making an assumption there. We've lost the caller. Okay, so you were saying confidence.
Yes, definitely. When you've got a good, good smile, you feel good about yourself. And once you feel good about yourself, you create positive things for yourself. So I think your smile is a really good starting point.
Do you think it's better for people to have this done when they're younger? Or, I mean, I had a brace when I was younger, but I noticed that a lot of people sort of older are having braces now.
Yes, that's because braces are always seen as something before, as when you were an adult, something you didn't want to have done, and that is because they showed, and you would then feel self-conscious during your treatment, even though the end result would have been good. And this is exactly why Incognito was produced for adults and also for children, but for adults, so that you can continue with your treatment, and only you know that you have the brace on.
Fantastic. Well, thank you for that.
Sorry, do you want a silly question? Is that available on the NHS?
No, it's not. Okay, so it's available in your practice, which is in Harley Street. 128 Harley Street. Well, thank you so much for coming on the show. Any last pointers for people, particularly directing them to your website so they can get some more information?
Yes, they can go to www.drsarahhepburn.com.
Fantastic. Well, thank you, Doctor. Okay.